Taiwan reported 27 domestic COVID cases on Friday, mostly in connection with previously reported clusters. 6 of the cases were in Taipei and New Taipei, and these were traced back to an infected real estate agent.
In Kaohsiung, there were 4 cases linked to an outbreak at the port. Another 4 cases were part of a hotel cluster in Yilan County's Jiaoxi Township. Let's hear from the CECC.
宜兰礁溪这个饭店，现在它总共有确诊的有它一个饭店相关的来源的总共有确诊的有13位。
At the hotel in Jiaoxi, there are now a total of 13 cases in that cluster, including the 4 we added today. Case 18703 from Kaohsiung had taken her family to Jiaoxi on vacation and stayed at the hotel on January 16th and 17th. She developed symptoms upon her return and then tested positive. One of her 2 children had symptoms, but her husband had no symptoms. He also tested negative. The next day, the child's symptoms persisted, so both children were tested and both tested positive. Case 18712 lives in Tainan, and after case 18703 returned to Kaohsiung, the 2 of them met for dinner on January 23rd, before both tested positive. As everyone knows, we had previously said we would follow up on guests at the Jiaoxi Hotel as far back as January 19th. However, because of this situation, we have extended tracing back to January 14th. The names of all previous guests at the hotel have been given to all the local health departments, who will follow up with tracing and testing.
Meanwhile, Taichung reported local cases for the first time since the Omicron outbreak. 2 local infections were found in the special municipality. One was a 21-year-old woman who had a CT value of 20. The other Taichung case was a breakthrough infection involving a 25-year-old woman with a CT value of just 16.73. She had recently visited Taichung Shalu District Farmers Association, as well as a medical clinic in the city. Officials said that both locations have been thoroughly sanitized.